Hello, I'm Alicia with Breakthrough Medical Withdrawal Management. Today we're going to be going over the patient inquiry record, intake packet, page 1. You want to put the date here, time, the room number if it was assigned. If the patient hasn't been assigned a room number yet, you'll want to go back and fill this in later. Your signature goes here, the caller name, relationship to patient, patient name and date of birth, the caller's phone number here, caller's work phone number here if they have it, patient phone number, home, and patient phone number, work. Caller address, work and home, patient address, work and home, city, state, and zip, and then the referral source. If it was anything other than these listed, you want to type that here or write that there. Patient evaluation, drugs or alcohol, and the last date and time of use.
Okay, go ahead.
Hello everyone, I'm Alicia with Breakthrough Medical Withdrawal Management. Today we're going to be going over the patient inquiry record, the intake packet, page 1 through 9 today. This one I've already filled out for you. The date goes here. I've put today's date. The time was 2:30. The patient's room number, if they've been assigned a room number, you'll place here. If they haven't been assigned a room number, go back and place it when one's been signed. Put your staff signature here, patient name, relationship to patient, in this case it is self, patient name, date of birth, caller phone number work if they have it, patient phone number home, and patient phone number work if they have it. In this case the caller is the same as patient. Street address, same as caller, city, state, and zip, same as caller. Referral source identification. If it is not any of these sources, you'll write in your source here. In this case it was Facebook. Substance used, drugs, the type of drugs, her last dose was on the 3rd, and the time of her last dose was at 2:30. Her financial information is here. She is a commercial insurance, female, age 29, her marital status is single. Policyholder is herself. Her policy group number is here. And how many children does she have? And the age of the child. So she has one child and the child is 18 months old. Social Security number goes here. Insurance, phone number, prior treatment. She was at North Brown in an intensive outpatient treatment. Contact person, transfer by family. If female is pregnant, and the answer would be no. Religion, Catholic. Emergency contact, in this case it is her brother. Contact number, relationship, brother. Admission criteria met, yes for this case. Patient admitted, yes. Date admitted, time. Referred out, no, because she met criteria. Agency is not applicable, and contact person is not applicable. Make sure you have no blank spaces on the form and write N/A where needed. Your signature, date, and time at the end of each page. We'll be moving on to page 2. The intake packet, page 2, is where you will list all of the comorbidities. If you do not see one listed, you'll write it out to the side. In this case, alcohol, marijuana, narcotics. She chose all three. Age for start was 14, 14, and 19. And then you're going to specify the route of delivery. In this case, with the alcohol, it is oral. With the marijuana, it's inhale. And then with the heroin, it is intravenous. Okay, and then you want to put the amounts next to the route. So the amount on her alcohol consumption was unknown, so you'll write unknown. And the amount of her marijuana, she smokes 1 joint per week. Then the amount of her heroin, it is intravenously 1 gram per day. So you want to write the frequency right next to the amount. And then the date of their last use. And then if they have any abstinence history with any of the substances that they're abusing, you'll write them out here to the side. So for instance, with the marijuana, she has 1 year of abstinence from marijuana. Intake packet, page 3. Medical conditions, drug use, hypertension. You can abbreviate. In this case, hypertension's abbreviation is HTN. And a history of MRSA. And the only prescription medication she's currently taking is lisinopril, and she takes 5 milligrams. This patient has no known drug allergies, so you'll write NKDA in this line. Is patient suicidal? No. Is patient homicidal? No. If so, if they do attest to being suicidal or homicidal, you'll want to refer back to your admission algorithm. If they are, then you'll want to screen them out and find them appropriate treatment. The intake summary, you'll put your COWS and your CWA score here. In this case, it is her COWS score, and she scored an 18, which meets admission criteria. And then you'll want to write their withdrawal signs and symptoms here. In this case, she's exhibiting tremors, malnutrition, sweating, insomnia, and vomiting. And then her medical comorbidities, which are from the previous sheet here, is her hypertension and anorexia. Intake packet, page 4, her intake summary. Her medications, she takes the lisinopril, 5 milligrams once daily, PO or orally. And the history of substance abuse in the past is marijuana use since 14, heroin use since 19, alcohol use since age 14. Patient was enrolled in North Pound's IOP program, but left AMA. High-risk criteria, and her only high-risk criteria is may have poor motivation. And the additional factors include patient's brother is very involved and proactive with her care. He is the legal guardian for her son. So any additional information or any factors that might impact care, you'll want to write here. Put the COWS score here, staff initials here, and then sign and date and time each page. Intake packet, page 5. The discharge planning summary. So her plan right now is outpatient, and this is pending. Patient will be returning to the Northbound's IOP program. And consent to release is yes. And then, are you interested in self-help support groups? And her answer was no. Sign, date, and time, the bottom of each page. Intake packet, page 6. Additional factors for consideration during withdrawal. And her craving scale is a 9. Her support system is 1 brother, and he is very supportive, so you want to place good. And then history of the following, check all that apply. In this case, she has blackouts due to the heroin use, cardiac issues, which was her hypertension, and depression. She is exhibiting nausea, vomiting, weight loss, malnutrition, insomnia, and headaches. Make sure to do a thorough screening. And intake packet, page 7, the final discharge plan. In this case, the provider named is Northbound. The contact person is Jim Avery. Address is 333 South Kirkwood, Suite 303. Phone number 314-678-1130. And then the date and time for discharge and the aftercare. So she'll be discharging on 4/7/19 at 2 p.m. and she'll be going directly to North Pound. And yes, we want to call to confirm 24 hours prior to discharge. And then the level of care on discharge is IOP. So you want to have the patient signature there, the date and time, staff signature here, and the date and time, so that we know they've agreed to the discharge plan. Okay? Intake packet, page 8. Patient Jane Doe, DOB, allergies or no known drug allergies. And you'll want to write the drug name, route, dose, frequency, source, who is the prescriber, whether or not they're compliant with the medication, and their last dose that they took the medication, and what are they being prescribed the medication for. In her case, it's lisinopril. You'll fill out the bottom with the pharmacy name, address, and phone number, and the PCP's address and phone number and the PCP's name. If you have any questions about a medication that a patient is currently taking, please consult their primary care physician. Intake packet, page 9, and this is if they agree to place a testimonial. They can sign this waiver, signature, printed name, date, and date of birth. And then we have our staff signature here if they would like to share a public testimonial. Thank you.